Jeff, just to follow up, my last question to you is, I know you talked about the Al Roker story. I was, fortunate enough to talk to him. The importance of seeing people like yourself, especially those maybe in the public eye, but just to get that, presence out there. What's the importance of having people share their stories, people like you, to make sure that other people are hearing that message of what you were talking about, getting screened earlier, and just taking better care of their health?
Again, the awareness, because a lot of times we don't know what we don't know. And so if you have a situation going on with inside your body, the more you know about it, the better off you are. A case in point, I was a few years ago when I was going to the minority men's health fair, I felt a little guilty because I have health insurance and I'm taking up a space for someone who does not have health insurance. Then after speaking to the director of that, he says, no, don't ever feel that way. If they see you are more interested in your health conditions, that would probably inspire others to do the same thing. And so I sort of changed my thought process on that. And so now that I've been diagnosed with this prostate cancer, more people need to become more aware of their bodies and take an interest in caring for themselves. Probably the most important one is get yourself checked. The quicker, the better. And so if there is a presence of cancer, you can get it treated quickly and get it taken care of versus waiting until later, because men of color tend not to go to the doctors a lot. And if they do so, it's always at the 9th hour. And so the sooner you can get it checked and get it tested or what have you, the better off you will be. And so that would be my conversation with him, or any man of color, to get checked and get checked quicker.
I'm really grateful to Jeff for coming on and sharing your story, because it's not easy to do sometimes, and especially sometimes with prostate cancer, people have sometimes some funny ideas about prostate cancer. But I think it is so valuable to share stories. I think we're good at sharing the numbers and sharing the mechanism of treatment and how to navigate through it. But that's the whole reason we do that is so we can have life. And I think that, when people can see Jeff now, he's gone through his treatment, he's still smiling, he's still doing stuff with his dog, he's still living life. I think that's really valuable. And knowing how to negotiate that, it helps people see that there is something up there ahead when maybe all you can see is that diagnosis initially. So I'm really grateful, Jeff, for you doing this with us and sharing your story. And I think we as doctors, or my message I think to doctors would be, we need to listen to this aspect of the story, because this helps us to understand, this helps us to select which treatment maybe is the best. And we need to really listen to, what do our patients value? What do they care about most? One of the questions I ask is, sometimes as doctors, we get stuck on thinking about how to improve the survival of the patient, right? That we get focused on the survival, especially cancer-specific survival. That's our wheelhouse. And sometimes we think about the cancer and we forget about the patient who has the cancer. And so I think I would just encourage doctors to listen to what the patient is saying, what they value, what they care about, where they want to go, and then we can help them choose the treatments that help them to meet those goals. And I really also appreciate what Jeff said about some of the disparities in prostate cancer, because they're marked in the United States. And it's interesting, we're beginning to dig into why this is. We know that African American men are more likely to get prostate cancer, and when they get it, they're almost twice as likely to die from it. And there's been a lot of, proposed theories as to why that is, but most of the recent data suggests it's largely due to non-biological related things. A lot of people have thought maybe it was all due to different genetics between African Americans and Caucasians, but the genetics seem to play actually a fairly slim role overall. It's more likely due to lower insurance rates among African Americans, lower access to care, lower education about these topics. And so I think these kinds of things are really helpful to help us begin to overcome these things. Because if people listen to Jeff, and go out and and get screened and be active participants in their healthcare, I think we will be able to shrink those discrepancies. And if we do things on a society level, like improve the amount of a number of people insured and improve, you know, educational outreach, that I think we can start to narrow these discrepancies.